Welcome back to this week's episode of 20 Tips to Save 20% on your group health plan. You know the drill. We're sharing strategies that you can use to lower the cost of your coverage. And this week we have tip number 8, include reference-based pricing in your plan choice. This is a good one and it can make a huge difference in your claims exposure. There's so much to unpack here. So let's start with the what. Like, what the heck is reference-based pricing, or RBP as we call it? Because you know how much insurance folks love acronyms. Simply put, it's a health plan strategy to lower the cost of a claim. Through a more detailed lens, it's a claims pricing methodology grounded in an analysis of an objective value for a medical service and adjudicating medical claims based on some multiple of that value. Wait, what? Okay, let's get back to simple. How does RBP work? The concept of RBP is to pay a fair and reasonable amount for a service that is no more than X percentage of what Medicare would pay for the same procedure. So why are we referencing Medicare? Well, that's because the federal government pays for Medicare as the single largest purchaser of healthcare in the US. Between Medicare and Medicaid, more than 35% of the population gets insurance coverage from the federal government. With this type of buying power, they're able to set the rates that they will pay for a procedure through the Centers of Medicare and Medicaid Services, CMS. So let's look at an example here. Here we have a knee replacement. Starting at the top, there's a $75,000 billed charge. But wait, your PPO network's gonna give you a 50% discount off that billed charge. So that knee replacement costs your health plan $37,000. But that same surgery center with the same surgeon performed that same procedure last week for $15,893. So why is your PPO plan paying $22,000 more than what the procedure costs another patient? Here we have an RBP plan that pays $22,000 for that same procedure. Tell me, which health plan would you rather pay for? The one that overpays for a procedure just because they led you to believe you got an in-network discount? Or the one that only paid 140% of Medicare? And that, my friends, is the beauty of RBP. Cost savings, flexibility in choosing a provider, transparency in healthcare costs. Tune in next week as we talk about a few ways you can implement RBP and eliminate the noise of uncertainty that a strategy like this might cause. Check the link in the comments for more on this strategy. Thanks, and I'll talk to you soon.